50% of infections acquired during in a healthcare stay are related directly to hand hygiene. 70% of healthcare workers do not adhere to recommended hand hygiene products.
Welcome to Beyond Clean with ACE. In the world of commercial cleaning, newcomers and seasoned professionals know we're more than just toilets, windows, and floors. We're just like everyone else with diverse interests in everything. And over the past 7 seasons, tens of thousands have discovered engaging, thoughtful, and truly game-changing knowledge here. Whether you're a facility manager, a frontline staff member, or a building services contractor, we're here to help you grow both personally and professionally. So hit that subscribe button and share with others, because we're all about enhancing lives in healthy, positive, and proactive ways. Now let's join Dave Thompson, Director of the Academy of Cleaning Excellence, your host here at Beyond Clean with ACE.
Hello, everyone. It is the last week of May. Yep, that's what I said, the last week of May 2024. I don't know where the year is going, but it's going fast for me. I don't know where it is for you, but you are on another episode here. As the intro said, of Beyond Clean with ACE, we talk about everything and anything that has to do with cleaning. And, well, maybe something else too. You never know where the conversation is going to go. Today, I'm going to welcome to the stage somebody that's been with me before, and, I never really can keep up with where he's at, what he's doing next, so he's going to have to tell us and keep me up to date too, but I believe we're both on the same coast this time. Brian, are you still on the same coast as I am?
Good morning, Dave. Yes, sir. Yes, sir. On the East Coast up here in New York City.
All right. Well, so you're a little further north than I am right now, but hey, we're both in the same time zone, at least this time.
Yeah. No challenges as it relates to time zones. You're right.
Before we get into this very far, let's catch people up. If they've heard you on the podcast before, they're going to go, okay, so I see a different banner behind you now than before. But, hey, one of my colleagues used to say, the cleaning business has a way of getting its hooks into you and never letting go.
Yeah, as much as the truth. So yeah, after I've been in still the same vertical, same church, different pew, so to speak. I started my infection prevention career some 20 plus years ago in hand hygiene, and always had a passion and love for it. Switching over from hand hygiene, the organization I was with was sold. So I made a transition out, still staying in infection prevention, but more focusing on the surface side of things in healthcare. So, I've done that for the last 10 years, and had an opportunity to come back, working with the same folks still, thankfully. Had an opportunity to come back to something that, like I said earlier, like I really have a passion for, which is hand hygiene. I'm excited. This is, aligned myself with an organization who is forward thinking as it relates to clinical as well as products. So I'm really, really excited about this.
Hand hygiene, you know what? It's a subject that during COVID, everybody was talking about all the time. I am not a fan. I'll just tell you, folks, if you've heard me before, which most of you have by now, I am not a fan of instant hand sanitizer. I think the problem with it is it tries to say that chemicals do everything, and I still believe in good old pH and physical removal. Dave,
listen, as elementary as it sounds, more the actual physical task, if you will, of just scrubbing your hands is mission critical. And being in this healthcare vertical and having the WHO and all of these like the Joint Commissions coming in and doing surveys, these survey companies, a large portion of the survey questions that we're seeing is related and is directly related to hand hygiene. And as elementary, and we're taught as youngins to just wash our hands. I cannot believe there is such a huge deficiency with just a simple task. So products do play an important role, but just like you said, the old, just getting in there and washing and actually just washing your hands could save a lot of lives.
And I think that's the thing, Brian, when we talk about this subject, it's like, my first thought is, why do we have to continually talk about something so basic?
Dave,
but yet it's a convenience factor that our world has gotten to be where we don't want to be bothered by anything. I mean, I don't know. I can get on a soapbox on this one.
Yeah, no, I mean, I can't agree with you more. And being involved in this and being involved in infection prevention, like I said, for the last 20 years, it's just so incredible. In this, in this era of, antimicrobial resistance, it's crucial that, everybody washes their hands inside a healthcare facility. And I get this question a lot, well, what are you seeing? Why aren't they doing it? And quite honestly, it's there's no, to get these people to break behaviors and these people, all healthcare professionals, from EVS all the way up to doctors, it's a behavioral change. And the only thing that changes behavior, as we know, is accountability. And having a program that not only encompasses proper products, products to minimize infection, but it's just more or less keeping these people, our healthcare professionals, in line as it relates to, their day-to-day processes. It's a very, very challenging thing, but we have, paired with our products, we have a wonderful training program, and that's what we've had excellent results, Dave, just by watching and being present on units, holding people accountable. A lot of these facilities now are coming out with, they're how are they gauging, or how are they gathering this information on when these doctors or nurses or EVS or anyone who has patient contact, how are they doing it? And a lot of these facilities now, and there's a significant amount of identification tools, RFID tools to measure, to gauge when a healthcare professional walks into a room, bedside activity, patient contact. But the only thing that really is going to help, like I said, is having that accountability and being on site, moreover than just a secret shopper, someone sitting on a unit counting how many times people go in. It's just actually peeling the onion down and working with each staff member, each division, nursing, EVS, doctors, and just as elementary as it sounds, is just getting to the root of the problem. 50% of infections acquired during, in a healthcare stay are related directly to hand hygiene. And the numbers are staggering. And just by
I would believe that 100%, because I just went to a new infectious disease doctor. Now, folks, listen what I'm saying. I'm there because I have an infectious diseases in my lungs. First time that I meet him, he walks in the room and wants to shake my hand after we're just starting to walk in the room. And I just went like this.
Yeah.
He looked at me and I said, I don't touch you until you wash those hands. And he grabbed the instant hand sanitizer, and I said, that's not what I said. I said, wash your hands.
Yeah.
But I think this is a job of everyone that's listening to this podcast. It's not just, like you said, it's not just the hand hygiene police.
Right. No, it's and quite honestly, it's vertical agnostic. I mean, we were just focusing on healthcare, but like I said, in education, we do a boatload of business with Simonides. You can just imagine our client roster. And like I said, it's vertical agnostic, from higher education, professional sports teams, all of these, and it's systemic. It's
all of us.
Yeah. It's astonishing the way. The way even in education, early ed or all the way up through our college campuses, it's it's systemic, and it's like I said, it's not vertical directly, healthcare. It's every vertical.
And I don't think, folks, that what Brian and I are talking about, we're not talking about don't use products. We're not saying that at all. But what you have to have is you have to have that physical removal, and you can't do it by chemical alone, and you can't do it whenever you want to. It has to be a culture, and it's every person's responsibility. It's not just one. We're all in this together because another pandemic is coming, folks.
Yeah, Dave, you're not correct, and specifically in the healthcare vertical, 70%, and this is just from, and you could fact check this on the WHO with the World Health Organization. 70% of healthcare workers do not adhere to recommended hand hygiene practices. Excuse me.
Okay, so then why do you find that, Brian? That's the whole thing we're talking about today.
That's right. So the reason is a lot of the ways, everybody's focused on patient care. Everybody's focused on like I said, patient care and getting everybody, and facilities being understaffed. We actually saw during the pandemic, you would think because of, with the virus and during the pandemic, all these healthcare workers were really super cognizant of the fact that they could transmit it via their hands. We actually saw a reduction in just utilizing some data that we had through, and it wasn't it was a secret shopper type situation. Utilizing that data, we actually saw the reduction of activations on these dispensers because, everything is undermanned. A lot of staff, there's a lot of nurses a lot of facilities that are working that are understaffed, doctors. So, the average, the nurse to patient ratio is gotten much greater. So instead of one nurse taking care of a unit on a 65 bed unit, one nurse taking care of, 3 patients, you have one nurse taking care of 8 patients. So the nurse to patient ratio is because of staffing issues it's really an afterthought. And
but doesn't this just become an excuse? Because I don't think there's any patient that you're talking about that would have a problem with the fact that it took 1 minute longer because I had to wash my hands.
Yeah, it's just, that's the thing. So you're having, a lot of these we've seen with the nursing, these teaching institutions that we work with currently, like these big health IDNs that are associated with these college programs, these so-called feeder programs for nursing and doctors, because of the pandemic and because of the influx of patients, these young people, God bless them, were forced to enter the workforce a lot quicker. So as it relates to training, I don't know if there's the big onus on that, but maybe we can equate that to. Quite honestly, I'm not certain, of the reasoning why, but I'm certain of one thing that, just a minimal doing something. If we can move the needle, even a couple percentage points north or better than what they were, that'll increase, that'll save lives substantially. Obviously, our objective is to get 100% compliant. That's obviously not, something that
70% is so far off of that 100% compliant that 70% are not doing it. I mean, that's
you're right. And
what in the heck?
Yeah, right. And that's the thing. So, and that's why it's very, very important, very mission critical for these IDNs, these hospital systems, be it memorial, local memorial hospitals or these big IDN to really, and again, not even vertical specific to healthcare, have a program in place. Once you establish a program, because right now I could walk into 6 out of 10 hospitals and it's willy-nilly. They're doing what they want to do when they want to do it. Right. There has to be a plan. And the only thing to stop what they're doing and to increase compliance scores is to, you got to hold them accountable. You got to hold people accountable. by literally walking up to them, say, hey, saw that, you had patient interaction. Did you, and no, I didn't. Okay. And then kind of just like opening up their eyes. So not only it's a complete program, it's not only just, product or just, just doing what we got to do as we were taught as youngers, to washing our hands, it's a complete program. And that's what our clinical thought leaders here at Simonides really took a step back and to see where these infections are coming from and identified.
Okay.
Board to see.
So let me ask a question. I know a decade ago when I was out on the street with you guys actually selling the product day in and day out, that there were ID tags, what I want to call, they could chip a badge so right. that when you went to the dispenser, you had to go to the dispenser, you were recorded and all of this. Where's that technology went? Why are we not doing this?
So great question. So a lot of the things, let me take it a step back. My first experience into infection prevention, you heard me mention earlier, was hand hygiene. And I worked for an amazing organization. It was actually my introduction into healthcare. That's what really, I worked for such a great team, spearheaded by our division vice president, Martin McGonigal. And we developed a system, a hand hygiene monitoring system.
Right.
We used it off an algorithm based on their nurse to patient ratio. They're prevalent. They're out there. I know a lot of these manufacturers have come up with them, but the cost associated with these devices and these RFID badges, and also the challenges with hand hygiene monitoring systems is the company that brings it in, you can't rely on the facility's backbone infrastructure. So you have to set your own LAN up. You have to set for activations. In particular, you mentioned RFID badges with the sensors above the ceiling. Doctors and nurses don't like to wear their ID tags. Getting them to wear that ID badge, because it's almost as if Big Brother's watching them, is very
Big Brother is watching them. I'm the one paying it for the freaking room bill.
No.
So you're telling me that all of these millions of dollars I'm spending on the room and everything, that it's not, my life's not worth that? That's exactly why I kept everybody out of my room when I was in surgery 4 years ago.
Yeah, no, that's, and that's the thing.
Sorry, folks, I didn't mean to get loud, but gosh darn it, I'm the one that was paying. That's the highest price room rate I'll ever pay for a room.
Yeah.
$500,000 after 10 days. Yeah. Come on. Yeah, and you're telling me that I don't like to wear something? I didn't like laying there in that bed.
Yeah, no, so look, it's inside the facility, it's that's why we said, and when we got this, when we talk about it, it's literally, it's got to be a behavioral change. And I'm going to say, you'll hear me say it 50,000 more times probably within the next half hour or whatever we talk. They're the only way to stop this and change and see compliance. We've done it. We've done it in many hospitals. And, I mean, just think about it, for any hand hygiene programs that can prevent up to 50% and can prevent 50% of the hand hygiene outbreaks, will pay for itself 16 times over. One infection in a small memorial hospital equates to about $30,000-$35,000. If we can stop one of those, the price, the cost associated with the products and training will, the ROI is significant, very, very significant.
Yeah, and that's why I don't get this, Brian. I'm sorry, folks. I'm just, this is such an ongoing thing, because when I was in surgery, for my heart and everything, I mean, the guy with the portable
EKG?
No, the
glucose machine.
all of the, well, it didn't matter. I don't want to be specific here. They come in the room and I'd say, wash your hands before you do anything. Well, we're not going to touch you. Oh yeah, you do. You moved me around and everything. You held onto my back while, so It didn't matter who walked into the room. I mean, they bring in my serving tray from the dining hall. And I'm like, you just left the last one, picked up the bad tray off of their table. Now you want to come in and do it on mine. Wash your hands. It was every single person before day 3 was over. Everybody knew if they were going to walk in my room, they had to wash their hands first. It's our responsibility.
Yeah, no, look, and obviously patient education is mission critical too. And, not all patients are, this is what we do for a living. So you and I know, but you heard me mention it earlier too. It's mission critical to get to implement a good hand hygiene program across every division within hospital, within higher ed, from the nursing, janitorial staff, EBS staff. It's because, like I said, these things can come from anywhere. So it's not just.
So you said a good hand hygiene program, Brian. You've said several times. Yeah. Let's give everybody an example of what we consider a good hand hygiene program then.
Yeah, so you got to partner with an organization, much like Simonides. We actually come in, we'll evaluate not only the products that you're currently using, make suggestions there. Also, have training, work on the units, spend time on the units. You're not going to, with myself, with one of our clinical thought leaders, a few of our clinical people, and just spending time on units and just interacting with them. Anybody and everybody who will listen, just spending time. You got to work really hard. And it's not something where, we drop off our products, we shake hands and part as ways. It's actually a partnership. So it's actually going in, offering products that are friendly, not only to the environment, but to the staff. Finding formulations specifically that won't irritate any skin. There's many different formulations that we manufacture, and then but the products are probably 10% of the whole to do.
Yeah, that's not the part of the equation that's important, really.
Yeah, the like I said, the training, spending time in huddles, being a part, having that interaction with the staff. Being on
so everybody says training. So what would break down good training? I mean, I call it knowledge. Yeah. You're calling it training. Break that down.
Yeah. So it's repetition based, right? So it's just continually driving the message.
That's what I wanted to hear, folks. Yeah. That's what I wanted to hear. This is not something you can have a 10-minute deal once every 6 months. No, this is something that you're not going to change that culture unless we do it all the time.
Right. And that's the thing. So you heard me mention too, it's accountability, being there, doing it with them as elementary. I can't believe actually we talk about this, and I talk about this probably 80 times a week, but just actually washing hands with people. It's just, these are the products that use anti-bac soap out, and being in these huddles on these units, with their 15-minute huddle, just telling the unit manager, say, hey, I just wanted 2 minutes of your time. Hey, I'm here. If anybody has any questions about, and you'll see their faces, they roll their eyes, but then then it's the rounds, working with them and just saying, hey, you're in and out. What'd you do? And it's just constant elementary, working with them. That's it. It's as elementary as that. And, you're not going to see results, within the first week, obviously, because it's behavioral, but you will see results. We've had facilities, the infection rates, were pretty substantial. And, with everything now, we could, because of the pathogen or the virus, or we could tell, where it's coming from. We've had great results. And then, like I said, that's just it. It's just being there. It's like when we were kids, you go into schoolyard, you don't misbehave. But if the teacher or whomever standing out there watching the recess is there, you won't, and then by that time, if you do that enough, it'd just be behavioral change.
But then you go back to behavioral change, Brian, and I like what you said about when we were kids. Now, let me ask a question. Folks, I think you're probably going to agree with me when I say this. We got rewarded for good grades. We got rewarded for good effort. We got rewarded. But somewhere along the line, we forgot that the way to change adult behavior is to reward them. So where's the reward program for hand hygiene programs?
Unbelievable question. So prior to, obviously, I was a Division I athlete, and a big part of what I do is competition based. And we reward units because, say a med-surg unit or a transplant unit, we reward units that we could see the greatest increase on, be it luncheons. We do lunch and learns. We'll get lunch for everybody, but there has to be part of the program. You're exactly right, Dave. And it's just like we were kids is the reward. So instead of an ice cream party, for winning game or doing good in school, we have lunch and learns. We have certificates, banners. We dangle a carrot, if you will, because that's part of it. A pizza lunch on a Friday, or for all three shifts, or whatever it is. And I ask the facilities what they want, and so you're right. A big part of it is having a reward for them to see results, right? Because that's what you got to have. You got to know where you're going and what you want to work for to achieve what we want to achieve. So we have those in place. That's what we do. We do lunch and learns.
Behavior will not change unless there's incentive to do so.
You need incentive. We are in a reactionary world. I mean, look at COVID, what it did. We reacted and we did something different, but that went away. So what do we do now? Yeah.
We're back to our old habit. I don't have time.
Well, that's what we've had. If you have a sustained program, and if you partner, each facility partners with the right organization, like I said, that not only has world-class products, but also that training program is mission critical. And what we're talking about encompasses the whole program. It'll be, the program works. It's a challenge. And, look, obviously, these facilities don't want anybody to be infected. There's significant cost associated with infections. You heard me mention before. And, obviously with the reduction of HAIs via hand hygiene, there's going to be, a program with minimal spend can generate, economic savings up to 16 times the cost of implementation. So it's just working with the provider, healthcare professionals, people that have industry experience, and coming full circle and really working. It's not just, it's a partnership. It's not just, Simonides with their SaniClean products going to come in and just because of that, we're going to see, better.
That's not going to do it. Just a product change by itself isn't going to do it. You've got to have the whole picture.
Right. And Dave, I can't tell you, and you know what, the comforting thing now, we're actually starting to see it more, I know sustainability is big, but also education within. So a lot of these big IDNs that we work with have an education department within. So, it's getting deeper and wider within the facility that we use, getting those relationships with those education, their education folks that are on site, because these nurses, doctors, EVS workers are going through constant trainings and it's being a part of that. So some of the facilities that we're actually part of the onboarding process. So we have a chance, we got to crack at these people when they come in, these EVS workers or these nursing, we're part of their onboarding. So we can start to understand. So we can kind of get their thought track saying, wow, we're being watched and this is what needs to be done to increase compliance. And if you that encompasses, a great educational program. And like I said, paired with the proper products, there's the amount of lives you could save and for a minimal spend, the ROI, return on investment, is pretty significant. With Simonides, the blessing about that is that education factor, that education component there's no charge for it. So it's just basically the products, and just to kind of just and I not to focus on a product, but I just our clinical thought leaders up in Connecticut really identified hand hygiene. Simonides has been around since 1913. Probably one of the biggest players in the Jan-San vertical. But our clinical thought leaders really identified healthcare and hand hygiene, not only in healthcare, education as something that's going to be mission critical going forward. And, being a part of something like that is really exciting, to the tune that, Simonides just spent millions and millions of dollars manufacturing for a manufacturing plant. So all the products we make are manufactured here in the lower 48. So so nothing's coming in from overseas. And that's something that our senior thought leaders, our clinical thought leaders really got together and really put together a nice program. And their commitment to hand hygiene is significant because, like I said, tens of millions of dollars to manufacture a facility here in Bolton, Connecticut. So their commitment to hand hygiene, my love for it, it's just been we're excited. We're getting the word out there. Obviously, people know, in the Joint Commissions, like you heard me mention earlier, Joint Commissions, majority of their survey questions were geared around hand hygiene. But it's just, we want to get our word out there. We're willing to help. We want to do whatever we can, to save lives and, keeping in mind the sustainability and, all of that stuff.
The thing is, folks, as you've been listening to the podcast here with Brian, the one thing that comes to my mind, as you've heard me already say, it's our responsibility to do what we need to do. And it doesn't stop. It doesn't start. It's always continuous. Yes, as I had with myself, as you probably have with family and friends, we all have certain health care situations and issues that come up. Just always remember, we're always trying to protect somebody's health. Yours is number one, because it's you're talking about. As I talk with students from all over the world, Brian, the one thing that's very interesting is how many people don't know that when you ask, what's the most important thing to you? And they start giving this laundry list because what about you? What about you yourself?
Well, Dave, that's the thing. So, that's one of the big messages we stress, obviously patient safety, but, these nurses, these EVS folks, the doctors, they, lest we forget, we want patient outcomes and we want everybody, but you got to protect yourself first.
I can't help anybody else if I don't protect myself.
That's exactly right. So, and that's what really, that's what we call peeling the onion, getting it really down and really seeing these epiphanies going off of, from these nurses or these doctors or anybody that we deal with within a healthcare vertical. You really start to see it once you kind of put it to that and peel the onion. You heard me mention that earlier. Because it's all about, you got to go with your job is there. Your job is there to give the best care when you're there you possibly can to these people. But we need to continue to keep them. You have to keep yourself safe.
This is one of those points, folks, where I keep saying I'm self-centered and I'm damn proud of it.
Yeah, I during Hand Hygiene Week a few months back, I was actually I was on Sirius Radio. We were talking. They had me on for a few minutes, and one of the things that Dr. Nilesh said to me, and it really resonated. We're bringing the most infectious, or we're bringing the most compromised people into an environment where, there's infection everywhere. And what can we do to do our part, and as elementary it is like I said, and it's just washing your hands and just doing what you need to do, not only to protect, the patients but just also to go home and protect yourself. It's something, so crazy and we talk about it ad nauseum, but the fact of the matter is, and the math will tell you, 70% of all healthcare workers aren't doing what they need to do.
Well, I think they're
not protecting themselves. That's the thing, right? So you got to protect yourself. before you can protect anyone. So,
and I think you're going to find that, folks, even though he said healthcare workers, if we had the studies we were able to, I think that's probably going to go for everybody in the population.
Oh, yeah. I mean, like I said, it's hand hygiene, especially now in this post-pandemic state, these noroviruses and cruise ships. I mean, I know them because I do this every day. Percentages in, cruise industry, health, hospitality, the percentages of people not being compliant with a simple task is staggering, including, our restaurant, and we can go down a rat hole here. But the numbers and the percentages of people that are not doing what they're doing, or they're not doing what they're supposed to be doing, as it relates to hand hygiene, you'll never leave your house, honestly.
Well, and I think this is the truth of the matter. We all are in this together. We all have to do our share, and simply washing these soap and water. And I don't care what soap you use. I really don't care at all, as long as it's pH. Water has pH. Physical removal is this, and a paper towel. Just the action of going through it, folks, is what we're talking about. Whenever you start adding different products to it, you only escalate that ability even further every time, but you still have to go through that physical action. Brian, that's exactly why I love talking with you, because we both are agreeing on the same thing.
Yeah.
Maybe a little different way we like to go about it. Hey, I mean, I've stood in their bathroom and watched people, how much they do. We could get into all of that, but hey, before you go, I do want to ask, have you achieved that bucket list item that we talked about a few years ago?
What was that? You remember?
You don't even remember what it was.
Fishing. Where was it? The fishing?
So apparently it's changed because you don't know that you achieved it.
I've achieved look. So I'm turning 50 here. I have the 50 top things to do before 50 soon. So I got another year and a half, but I don't recall. It's been a while. What was it? Refresh my memory.
See, the thing about it is, folks, I always ask this question, and this is it. We're living life. We're getting there. We're moving forward.
Yeah.
We hope that you're on a good and healthy path. That's why we love to talk with people here on the podcast, Beyond Clean with Ace. Make sure that whatever you do between today's visit with you and the next time we talk, keep it healthy, positive, and proactive. Thanks, folks, for listening.
Thanks, Dave.